So welcome again to 3 to 5, our regular 3 to 5 minute video presentations. And in this session, we're going to discuss the cost crisis aspect of the global health crisis. So let's first look at the projected global expenditure on healthcare. Now, a study by the World Economic Forum in 2011 projected that it will cost the people of the world $47 trillion over the next 20 years. And most of this money would be spent on the 5 leading chronic diseases. Now, the tragedy of the healthcare cost crisis resulting, from the current allopathic disease management model is clearly seen in this statement, issued by the World Health Organization. And it says that 100 million people are pushed into poverty by their medical bills each year. And its Director General, Dr. Margaret Chan, she had this to say. She said, no one in need of health care should have to risk financial ruin as a result. So if you look at this infographic, which says that Americans can't afford health care, and that 60% of personal bankruptcies are linked to medical bills, it's not only Americans, of course, but many people in many other nations across the world also, go into bankruptcy because of high medical bills. And we should not forget, of course, that not only are people impoverished because they are unable to afford decent health care, but many also die as a result. So now let's have a look at the projected, government spending on healthcare in South Africa. Now, in 2014, the Minister of Finance, said that more than 492 billion rand would be spent on healthcare over the next 3 years, as the country strengthens its healthcare system in preparation for the NHI scheme. And according to the Council for Medical Schemes, in their 2014-2015 report on medical scheme expenditure, this expenditure was 124.1 billion rand in 2014. And of this, 46.6 billion was paid to hospitals. And the lion's share, most of this hospital payout or costs went to private hospitals, of course, and 29.1 billion rand went to specialists. In fact, hospital costs in this country ranks amongst the highest in the OECD countries. And this is a statement put out by the Department of Health of the South African government. Okay, so the obvious question, of course, would be what actually drives costs? Now, I've done quite a bit of work in this area, but I think it's best, to wait for the findings of the Competition Commission's inquiry into private healthcare. As you can see here, the Commission is conducting a market inquiry in the private healthcare sector in terms of the Competitions Act. So we actually look forward to reading the report, of its findings when it's published. But if you're interested in reading more about the market inquiry and the rising cost of healthcare in South Africa, there's a very good article on the Mail and Guardian website. And as you can see, the article is entitled "Private Healthcare Inquiry Counts Costs of Medical Aid." And it states that, the inquiry has come about because of the ever-increasing costs of private healthcare, which have risen well above inflation in recent years. And you can find this article at this URL. And there's also, as you can see, a very good infographic explaining how your money is spent, or your medical aid money is spent on health care. Okay, that's it for now, and thanks for your time.